right. Welcome to the lecture version of the massage therapy techniques. We're going over head, neck, and face. So when we do the lab together, we're going to palpate the skull and the neck and kind of feel around for some bony landmarks. For the skull in general, we're going to try to find some bony landmarks, try to palpate the muscles of mastication. We're going to feel around the temporal mandible joints, look at headache-related muscles and some common conditions and injuries involving the head. For the neck portion, we're going to again look at some bony landmarks, some key cervical muscles that are important in the massage world, as well as palpation techniques to get to these muscles, and common conditions and injuries to the neck. So by the end of this lecture, you should be able to identify some bony landmarks of the skull and neck. We're going to go to the skull section here right now. We're going to palpate muscles of mastication and common headache-related muscles. We're going to find the TMJ joints, look for any mobility issues or any tenderness on your classmate. We're going to recognize palpation findings associated with common skull and facial conditions. And for the neck, again, we're going to identify and palpate superficial and deep cervical muscles. Recognize the palpation findings linked to common conditions and injuries. Most of it is probably tension headaches or tech neck, whiplash. We're going to take these palpation skills, assess and treat, and plan a treatment for your client. So these are not all of the bones in the skull. I do have everything labeled on the picture to the right. There is an anterior view and a lateral view. So some of the main bones that we're going to go over in the skull is the frontal bone, which will be, as the name says, the front of your skull. Your temporal bone, so these are the bones on the side of your head nearest your ear, where your temples would be. Your parietal bones. There are two parietal bones, and that is the side of your skull. In this picture here, it's pink, and you can kind of see they're right above the temporal bone. You have your occipital bone, which I'm showing here in like a grayish color. On that lateral side, it is the back base of your skull. Some key landmarks that we're going to go over for the occipital bone would be your external occipital protuberance and your superior neutral line. Last one here is your maxilla and your mandible. So I'm not sure why zygomatic is not in here, but that is your cheekbone right in here. The maxilla is that front part of your skull, kind of surrounding the sinuses and the nose and your upper lip. Then we have your mandible, which is your actual jawbone in blue. So some key landmarks for the maxilla and mandible would be your zygomatic arch. We have your mental protuberance and the angle of the mandible. Here are some key bony landmarks for your neck. So this is neck, and it's going to go over the anterior and posterior section. So I put neck and chest here. First, you guys need to be able to identify the spinous processes. So as I said before, the spinous processes, we'll call this the little dinosaur spikes that are on the back of your spine. Next, we have your transverse processes. You need to be able to kind of try to palpate those. The transverse processes are on the sides. I like to call those the airplane wings for your spine. Then we have your hyoid bone. So over here is the hyoid, right under the mandible. It's usually around the C3 level. So this is where you will see this general area where the Adam's apple would be on some people, a little bit lower here. Then we have your thyroid cartilage. So that is the Adam's apple right here, the thyroid. And then last but not least, we have clavicle and manubrium. So the manubrium is the top of that sternum, and then the clavicle where it connects. Alrighty. Palpation techniques to the skull. I mean, in general, you're always going to start anywhere with a gentle pressure as you're applying the lotion for effleurage to palpate and apply your lubricants. So the skull here, it says the skull is sensitive. It can be, but also in some people, they can take a lot of pressure on the scalp. And I think it feels really good to have someone really dig their fingers into the skull when they're doing the massage. So as you guys are palpating, start with gentle and then increase to your moderate pressure. Trace the contours of the skull. Try to find bony landmarks with the tips of your fingers, kind of the pads of your fingers, because you don't want to poke them too hard. Compare sides for symmetry, and compare textures bilaterally as well. So you might notice that one person might have a little more give on the left side of their face and a little more tension maybe on the opposite side. Maybe it's around the jaw and might point you in the direction of having some TMJ dysfunction or just tension in general. For the muscles of the skull, palpate during active movement so that you can feel them easier. So you can have your classmate clench their jaws, chew open and close their jaw, deviate it just so you can feel different muscles. It'll be a fun little activity. Neck. So when we're doing the neck, again, start with the gentle pressure. The neck can be sensitive as well and very vascular. Remember the posterior and anterior triangle of the neck. You want to be careful of the carotid and the jugular, as well as lymphatic vessels as well. Work superficial to deep. So again, we're always going to do this. We're going to start lighter and then get deeper. You want to warm up the tissue before you go in full deep tissue. Again, compare your bilateral sides. Make sure maybe you're noticing one shoulder is elevated or whatnot. Always be mindful of, again, your carotid arteries, your jugular vein, your trachea. You don't want your client to feel like you are choking them or harming them in any way. So if you are doing work around the neck, perhaps STM or scaling work, make sure that you communicate with your client or your classmate in this instance. Make sure they are comfortable with your hands in this area. It also be mindful that some victims of violence might not want this area worked as well. So always communicate with your client to make sure they are comfortable with the treatment that you are doing. Use active motions to differentiate different muscles. So when you're feeling around and palpating the neck, try rotating the neck or laterally flexing the neck, and see if you can feel any difference in the muscles. You should be able to. Alright, there are muscles of mastication that we're going to go over. Mastication means chewing. So these are the muscles that you need to be able to chew so that you can chew your food, swallow it, digest it, and so on. First, we have your masseter muscle. You can palpate this at the angle of the mandible during clenching. So that's that big meaty section on the side of your jaw. This is the masseter muscle. You can feel it if you clench your teeth. Palpate it. It's nice and meaty. Then we have our temporalis. So this covers most of the side of your skull. You can palpate this along with the fossa that it's sitting in during clenching as well. So clench, you can feel your masseters tighten, and if you clench, you can feel your temporal muscle also contracting. Then we're going to talk about both the medial and lateral pterygoids. So there's some pictures or images to the right here. These muscles directly are related to TMJ dysfunction. So first, let's talk about the medial pterygoid. So the medial pterygoid is difficult to palpate externally. Typically, you are going to feel this muscle by doing an internal release. So intraorally is another term for that. You would feel around for tenderness and kind of try to do a release there. Don't forget to wear gloves because that's gross. The other pterygoid muscle, lateral, is a deeper muscle, and you can palpate it indirectly near the TMJ region. So right here, this section here, we got the medial pterygoid, and then we have the lateral pterygoid up in here. The function of these muscles is to elevate, depress, cause protrusion, retraction of the mandible. Muscles related to headaches. So there are a lot of muscles that can cause referred pain into your head, giving you headaches. The big one for tension headaches would be your temporalis. So if I'm going over here on the side of the person, again, remember that's around the temple region. So your temporalis there could cause headaches if tight. Then you have your suboccipitals. Right, so your suboccipitals would be in just general region here. We're going to pop up to the top. So all these tiny little muscles in here are in the suboccipital group. So any of these tiny little muscles that help extend and rotate your neck a little bit can become tight and cause headaches as well. Then we have your frontalis muscle. So your frontalis muscle are these muscles in the front right above your eyebrow in your forehead. A lot of your facial muscles are actually used for expression, except for, your mastication muscles that, could be used for expression as well as eating and chewing. Your SCM. So referred pain in your SCM could be sent to your eyes and your head. So in this picture, I'll show you both here, but you can have your SCM crossing over here, right? And then you have on the side view, your SCM coming across here. So if this is tight, or if there's trigger points in the sternocleidomastoid, you can have referred pain with like a headache coming around your eyes or like around the eyes. I lost my train of thought. Okay, referred pain around the head and eyes. Okay, your upper trapezius. Again, remember your trap is a very big muscle, but when we're talking about upper, we're talking about these upper fibers in here. I'm going across them to the right. So when you have trigger points or tension in these upper trapezius fibers, it can cause referred pain into the head and into the temples. So remember, the referred pain doesn't mean that is where the pain is coming from. So maybe they're having pain in the temples, and it might also feel good that you're massaging the temporalis muscle, because that could also be contributing. But make sure you cover all your bases and get all the muscles that might refer pain to that temporal region as well. Goody goody, here is the temporal mandibular joint, TMJ. So when we are palpating this, you're going to place your fingers anterior to the tragus of the ear. So find your ear. The tragus is right in front of your ear canal. So right in front of there, you can kind of feel it's easier to feel if you open and close your jaw and deviate it to left and right. So I'm doing that now, and you can kind of feel that TMJ where the mandible connects, right? So palpate the condylar movement when you're opening and closing. So when we're doing this, we're assessing different things. Is the movement smooth or is it irregular? Is there clicking or popping or crepitus? Is there tenderness or guarding in that area? And then compare both left and right sides to see if one side is feeling different than the other. Maybe they feel the same. Maybe they're both tight, popping and clicking. So you want to treat the appropriate side or spend a little more time on the appropriate side. And if you don't know, just by using your palpation skills, because we're all learning, you can communicate with your client and ask them, when you feel pain, raise your hand here and whatnot. Right now we have some superficial neck muscles. So, superficial is closer to the skin. We have tons of layers, but here are the superficial ones. So I'm going to actually jump down to the last one first, because that is super superficial. So see how this looks like a giant blanket, this platysma? So this is the platysma. It is a giant blanket. It's a thin sheet over the anterior neck, okay? A lot of times you can see the platysma when someone makes the lizard neck face, right? So you can try to kind of do that, and it pops your mandible out and gives you all these weird wrinkly things along that platysma. So that's what is happening there. Your sternocleidomastoid. We call that the SCM because sternocleidomastoid is really long. So you can easily palpate that SCM when you rotate the neck. I've also found that it's easy to palpate on the same side if you laterally flex it as well to that same side. Last but not least, we're going to talk about the upper traps, which we've already brushed up on. This stems from the neutral line at the occiput, at the back of the head, and then it runs down, at least the front part of it, right here, and connects onto that clavicle and the acromion right across here. So that's why it's also pretty important when you're dressing the neck to also get into the pecs or any tissue above the clavicle, just to kind of free that up as well. So some of our deep and postural neck muscles are here. First, the scalenes. The picture of the scalenes is going to be on the bottom. The scalene group consists of an anterior, a middle, and a posterior scalene. So scalenes are lateral neck muscles, so they're kind of on the sides here, and you can palpate them easily during breathing. The scalene muscles are really important to loosen up when there's headaches, or if you're having any issues with numbness down the arm. There could be some pinching at the brachial plexus caused from the scalene muscles. So we will learn how to palpate those and work on those safely, even though they're between those triangles that are, supposed to be endangerment areas. But we can safely work on the scalenes to relieve our clients from some tension there. Then we have the levator scapula. So there's actually not a picture of this, but this is a posterior lateral neck muscle. It is tender with postural strain. So one of the main actions of the levator scapula is to elevate the scapula. So typically it is going to be, I wish I had a picture to show you guys, because this view isn't the greatest here, because this is an anterior view. But if I were to be looking at the scapula, the levator scapula is going to be on that superior angle. Connect there and kind of run up to the neck. All right, so your suboccipital region would be this top upper left. So these are your deep little suboccipitals. So again, these are responsible for tiny rotation of the neck as well as elevation. I mean extension, not elevation. Extension of the neck. Wrong E word. Last, we have the longest capnus and the longest coli. All right, so these are deep stabilizer muscles. They're hard to palpate directly. So typically what we're going to be doing when we're trying to get these deep muscles is just work slow and with intention to kind of get to these muscles. A lot of times what I do is I'll hold on to the skull and kind of rotate the head back and forth just to get different muscles. All right, here are some common TMJ conditions. TMJ dysfunction. Palpation findings would be tender joint line, muscle spasms possibly in those masseter muscles, or temporalis. Symptoms might also include clicking, locking, restricted opening, headaches. Remember, a lot of TMJ dysfunction also causes tension in the neck and head muscles. Then we have bruxism. That is a fancy word for teeth grinding. So during your palpation findings, you will find tense muscles, tender muscles, and sore muscles, specifically around the masseter and temporalis muscles. You can also have arthritis in your temporal mandibular joint. Palpation findings would include your crepitus, so your cracking and your grinding sounds, stiffness, and tenderness in the joint line. So to the right, here's a couple examples of bruxism. So the teeth grinding could be clenching. It could be the actual grinding, back and forth, or tapping as well. Now remember, we can't diagnose anything, but typically a client will tell you they're having issues with their TMJ, or maybe they have been diagnosed and they've been sent to you to get massage therapy done. So here are some common skull and head conditions that we're going to treat. So first, I would say the most common issue we deal with for the head and skull would be headaches. So it could be tension headaches, which would include tender temporalis, occipitals, or upper traps, any muscle in the neck and upper shoulder region. Migraines. Sometimes people with migraines are hypersensitive, so careful with your palpation during a migraine. A lot of times people aren't going to want to get a headache or get a massage when they have a bad migraine. So they might have light sensitivity. They might be hyperalgesic in the scalp and temporalis. They might have sound sensitivity or nausea. So like I said, most people aren't going to get, when they have a true migraine, aren't going to want you to touch them. So then we have sinusitis. So this is inflammation of your sinuses. So a lot of times with inflammation in the sinus cavity, you're going to have tenderness over the frontal or the maxillary sinus regions. And we can do sinus releases to kind of help free that up a little bit. It's not magic, but we'll help as best as we can. Then you have your temporal arteriitis. This is a tender artery, usually over the temple. If somebody seems to have an inflamed temporal artery, you're going to want to send them out the door to get an urgent referral or an urgent doctor's visit. Occipital neuralgia. So this is tenderness in the suboccipitals that can radiate pain. Now we have some common neck conditions. So a big one would be muscle strain. With this, there's localized tenderness. There can be tight SCM and trapezius muscles. Any of those muscles in the neck and head could be, in the shoulders could be strained. Whiplash is a big one. The picture shows whiplash, what's going on with the cervical spine during a moment of whiplash. So usually there's diffuse tenderness, guarding and other muscles to protect the area of injury, and restricted range of motion. We can have cervical sprains. So this is a ligament. So a strain is muscle related, a sprain is ligament related. So this is pain over the ligaments of your interspinous and supraspinous. All right, cervical disc herniation. So you can get a herniated or a bulging disc anywhere along the spine. So if there's a herniation or even, bulging disc, there's going to be guarding there, paraspinal tenderness, and referred pain. Then we have something called the facet joint irritation. So within, the vertebral joints, there's going to be a facet joint. There can be point tenderness around there, laterally to the spinous process. So all those conditions can be common with neck injuries. Headache-related findings. So this picture to the right shows some trigger points in the SCM and their referred pain patterns. So SCM can refer pain to the forehead, around the eyes, the ear. You might even get some random weird little referred points as well. Suboccipitals. Associated with the cervicogenetic headaches. So these are your secondary headaches. So these are headaches caused from something else typically. So a lot of times the suboccipitals are directly related to those secondary headaches. Then we have your upper trapezius fibers. This can sometimes refer pain into the temples or the posterior side of your skull. Your temporalis can also cause referred pain down to the jaw or neck tension and cause headaches there. TMJ and neck connection. So neck muscle tension is often linked to TMJ dysfunction. Your SCM and your scalenes can tighten when the jaw clenches. So see, everything works together. We also have all that connective tissue, that fascia that kind of joins everything together. Remember the demos we did where I did a little traction on the neck and you saw the toes move a little bit just because everything's connected. A palpation tip for TMJ and neck would be to assess your SCM and masseter together with any of your TMJ dysfunction clients to see if there's any tenderness or pain in those muscles. Some red flags. Obviously, if there's severe pain with palpation, that's not a good sign. Any visible deformity of the mandibles or skull, you're not going to want to work on them. Temporal artery tenderness, so typically that might require an urgent medical visit. Numbness, dizziness, or neurological signs, you might want to send them out the door to go see their doctor. Any acute trauma, usually the trauma is like 2 to 4 days. You're not going to want to work on someone directly after having whiplash in a car accident or any kind of trauma. You want that acute stage to kind of die down a little bit before you touch them. And if you're afraid to, make sure you get a doctor's note if there was a traumatic injury. The doctor's note would clear them for massage so that you can safely work on them. So if there's any tenderness around the carotid artery, obviously this is urgent. Send them out the door to go see their medical professional. Acute trauma with swelling and bruising, you're going to avoid. And then unexplained lumps or masses. So as a massage therapist, sometimes we find things before clients know they exist. And you have to get to the point where you're comfortable enough to point those out in a sensitive way. All right, hands-on. So you guys are going to partner up. We're going to try to find the mastoid process on the skull. Trace the zygomatic bone. Look for the mandible angle. We're going to also palpate the temporalis and the masseter muscles when clenching. Okay, palpate suboccipitals and the base of the skull. We're going to have fun with the TMJ and kind of palpate that during opening, closing, deviation, retraction, protrusion. And then kind of make a mental note. You don't have to document it unless you're actually working on this person and you're doing your SOAP notes, but kind of make a mental note of any tenderness and symmetry. For the neck, I want you guys to try to find that C7. Remember, C7, T1 is right when you have that curve change. So when you feel that bump on the back where your neck and your shoulders meet, that is your cervical spine 7. Cervical vertebrae, I mean. Again, mastoid process is thrown in the neck as well, and your clavicle, which we have palpated and should know where that is located. For the neck, I want you guys to try to feel the SCM from attachment, from each attachment point from your mastoid process down to the sternum and the clavicle. We're also going to palpate the scalenes. You can try during inhalation and exhalation and see the difference between the two, because the scalenes do help with inhalation as they connect to that first and second rib. We're going to palpate the suboccipitals again of the skull. I know there's some repeat, but skull and neck, it kind of all goes together. And then again, compare left and right sides for symmetry or tenderness. Here's some of the reference guides for some of the books we use to find this information. And have fun.